Stay Lit, A Prescription to Avoid Doctor Burnout, 2020, by Dr. J.W. Crosby, MD. Change. All this is simple and common sense. So why are so many doctors late most of the time? The hardest thing to do is to change. We spend our careers trying to get patients to change their smoking, eating, and exercise habits, so let's treat ourselves like our patients. First is diagnosis. Are you always late? Do your patients joke about how busy you are? They are not amused, but can't say anything to you. Secondly, you need to want to change. Being on time will be wonderful for you, your patients, staff, family, and friends. You will have lots of time to spend clinically instead of with paperwork, computer work, or on the phone or in meetings. You will have time for rest, exercise, hobbies, meditation, and spiritual replenishment. Also, your income will go up. Set up a start date. Just as we tell smokers to pick a start date and tell everyone, so should you. Just like with smokers, there will be failure and backsliding, as it is hard to change old habits. Just get right back up on that horse and keep riding. You will get lots of support from your staff, as they will benefit from happier patients far more than you will. Also, right now, take out your smartphone and email your secretary to start booking no one on Mondays. Leave it wide open for same-day call-in appointments. Miscellaneous. Vacations won't fix a toxic workplace. Sit down with your spouse or friend and your calendar this Sunday and block out 8 separate weeks vacation, 2 in a chunk, for the next 365 days. Take a red magic marker and circle them. These are sacred and should only be overridden by death in the immediate family. Sorry, Grandma. Copy it to your staff, family, call partners, hospitals, and nursing homes. Personally, I used to take a week off alone with my wife in February. This rejuvenates our marriage and helps with the winter blahs. We then take a week with the kids in March. In July, we send the kids to camp and have a week alone in the cottage. In August, we take 2 weeks with the kids. The definition of a good vacation is when you can't remember what day it is. Now, at age 72 and semi-retired, I have a nurse practitioner cover me for a month in Florida in March, the first 2 and last weeks of July at the cottage, and also the last 2 weeks up to Labor Day. We then go to a big city for a conference in November and take the week off between Christmas and New Year. Unplug your smartphone. In November, we go on an educational week trip. If you can't get a locum, sign out to another family doctor and reciprocate. Leave extra room in your day for the other doctor's patients. Remember to leave your first office day back empty, so you can enjoy it too. Your staff and patients will love it as they can get in to see you fast. Prescription renewals. With compliant patients, I book visits for most stable problems such as diabetes, hypertension, and hyperlipidemia every 6 months and give them a prescription for 100 days with 3 refills. We deal with our pharmacies by fax, stat, and tell patients to call the pharmacists directly. This avoids mistakes, is more efficient, and avoids tying up your front phone line. E-prescribing is just starting to be piloted in Ontario at this printing. Missed appointments. We post a notice that missed appointments will be charged for at the provincial rate for an intermediate assessment. If they miss 3 without an excuse, they are asked to find a new doctor or use the walk-in if they can't find one. I like it when people miss as I get a break. Internet downloaders. Look on this as a positive. It means the patient is interested in their care. I direct them to good websites and remind them that there are a lot of snake oil salespeople trolling the internet trying to sell them miracle cures. I have even had patients come in with a picture of rashes on their smartphones. I have emailed videos of tremors, with the patient's permission and with no identifying features, to neurologists. Computers. Don't let the computer be a wall between you and the patient. Have them pull up a chair and go over lab results together. Print off a copy for them. Specific patient problems. Fatigue. I don't deal with this on the initial visit. I make sure they are not having a myocardial infarction or extreme anemia, and if it's a young, healthy patient with months of fatigue, I order appropriate blood work like CBC, lights, creatinine, fasting blood sugar, HIV, and STSH, and rebook them for a full physical. I tell them that most cases of tiredness are due to stress and overwork or depression. If their lab comes back normal, as does their physical, I rebook them for stress counseling or delegate to a therapist. Cerumen in ears. Have the patient install ceruminal vegetable oil nightly for 15 minutes by the clock, lying with the affected ear up. Have them do this for 14 days, then syringe. If 3 tries don't work or there's pain or blood, refer to an ENT specialist for ear canal suctioning. Alzheimer's dementia. Always book an extra appointment for the caregiver. Talk to the patient even if they are confused. It shows respect. Journals. I keep them in a 4-inch drawer, and when I can't close it, I throw them out. I always take them with me in my briefcase to read if I am delayed. Now most are online. Stick to a few useful ones. Smartphones, laptops, and tablets. There are apps for dictation that you can email to your charts and apps for limited use forms for provincial drug benefits. Codes ON in Ontario. You can Google diseases and show pictures to the patient in the exam room. I use my smartphone to do my calendar and the stopwatch feature for pulse and respirations and the GPS feature for house calls. I use the flashlight app for looking at skin lesions. Office setup. Have a door to keep everyone but the patients out of the exam areas. Have 3 exam rooms set up to do everything in, except babies and minor surgery. This will enable you to go to another room for small cases while someone is disrobing for a physical. If you have just one secretary, she can use a Madonna phone and chaperone you as necessary. Use your private main office room for paperwork, emails, and counseling. ER and walk-in time management. As a specialist in ER medicine for 20 years, I learned a few tips to stay on time. Have a fast track area with a dedicated doctor and nurse. If you try to cover it from the main ER, the staff will be so busy with big cases that they will let the little ones languish. If you don't have the people power, you can have the ER physician start her first 2 hours in the fast track, then migrate to the main ER, and so on with each new doctor coming on. Ring block. Anesthesia for digit surgery. If I have a patient with a cut finger or who needs a paranesia lanced, I put in the ring block, then go see other short cases, and when I get back, it is working. Good time management and good patient care as it had time to work. A watched pot never boils. If I need a nurse to help me with a pelvic exam on a woman with abdominal pain, I would do the history and physical, then put on the chart as a doctor's order, "Get me when nurse ready for pelvic exam." I didn't pull the nurses in all directions, and the equipment and staff were all ready at once. Empower your triage nurse to use protocols like the Ottawa ankle rules to order appropriate lab and x-rays when she sees the patient. Have handouts on one piece of paper for follow-up, head injuries, wound care, etc., and have it in every room. Have every room set up to do everything in, except casting, eye slit lamp, and suturing. Send patients back to the waiting room if appropriate, if they are awaiting tests and are stable. This will free up beds. Use jerry chairs instead of gurneys to avoid patients and staff thinking they are bed patients when they have just been sitting in your waiting room. Administrative medicine. I have worked as acting medical director of a hospital, medical director of 3 nursing and 4 retirement homes, chief of surgery when no one else would do it, and chief of ER. Meetings. First of all, ask if they are necessary. Can they be combined? Can they be less often? Can we do them by text or phone or email? Have no more than 7 people and call it a task force. Have a set problem list and timeline and destroy the task force when the mission is accomplished. Have an agenda. Rule people out of order if they stray. Start on time and lock the door. Stop early. Have a secretary record minutes and have an action plan with one person in charge with milestones. For example, Dr. Crosby to order sandwiches by May 1st. Have a critique or 5-minute survey emailed in within 1 day. Make it anonymous. Was the meeting the right length? Was the agenda followed? Was there time for discussion? Did everyone have their say? Did it end early? Complaints. Call the complainer within 1 day and thank them for doing so. Assure them there will be a fast, balanced approach and all sides will be listened to. Give them a timeline for resolution. Warn doctors to consult with the CMPA if serious. Get everyone involved their opinion in writing and verbally. Have a meeting with all concerned and let everyone speak. File a written report and copy all involved. Tell how things will change in future to prevent this. Change the process. Vision. Your job as chief is to not spend all your time putting out fires, but to take time to look ahead into the future and have a vision for what will be happening and how you're going to plan for it. Take time off each week just to think. For example, the population is aging, budgets are shrinking, and new technology and diseases are happening all the time. How is your area going to cope with this inevitable change? In summary, the top 10 time management tips for doctors are: 1. Limit your practice to 1,500 patients. 2. Avoid talking on the phone. 3. Return faxes, texts, and emails stat. 4. Only do MD stuff. 5. Do paperwork and computer lab imaging weekdays at 8 a.m. 6. Take lists from patients. Do the top 2. 7. Seniors. What's new? Bring in all meds and a caregiver. 8. Volunteer for 1 hospital job yearly on your time preferences. 9. Delegate counseling if possible. 10. Consolidate nursing home patients.